So the king tubes come in a package like this, you guys. So you're gonna have your tube, you're gonna have this big syringe, and you're gonna have some lube to help insert it. And then it tells you, based on, what does this one say? It tells you based on the height of the patient, which one you're gonna use, and it's based on color. So I'm sure there'll be a spot right there. So if you open it, right there. You'll use this large syringe. And also within here is the package insert that tells you how much air to put in it. So I have a size, let's see, green, orange, yellow, red, purple. Red, the red one, that's the adapter. So the red one is gonna get 60 to 80 mLs. You put a lot of air into these, which is why this big syringe comes with it. So pretty much the whole thing. And you're gonna take this, and you're gonna, of course after it's in, but we'll talk about that, and then inflate it.
What is that for?
I'll show you, there's a much better picture coming up. So when this is in the patient's airway, and if she doesn't have a link on here, I'll pull up one that shows how to actually insert it. So when we insert this in, it's gonna be like this in my patient. You actually go to the side and then twist it and advance it forward. So this is gonna go into the trachea. No, I think I'm telling you backwards. This is gonna go into the esophagus here. So when you put it in, because that's the natural way it'll go. So this will go into the esophagus, but the cuff is gonna block it off. And then you also have a cuff way up here, see? So that's gonna block off the oropharynx. And then there's another hole here so that air can go right into the trachea from it.
So you don't need like a blade, you just...
These are meant to just be inserted. So these are a lot of times used in the field. We don't use them a lot in the hospital, but
Why not?
That's just temporary.
because it's a temporary airway. So they use a lot of times out in the field. To be honest, the LMA is used more than anything because it's easier to insert. There's less problems with it, but the king tube is also an option. And then this is the LMA. This is the laryngeal mask airway. Again, this is based on size. This is super easy to put in. So this is meant to block off the esophagus. Once we insert air into it, it's gonna put air into the cuff around this. So this is gonna go up, you put it in, follow the roof of the mouth, and then go back into the esophagus. This blocks off the esophagus, and then here is the hole where air will automatically go into the lungs then. That's what, so. If you have to call like anesthesia for a difficult airway emergency, like you guys can't get the patient intubated, they will come with a difficult airway cart, and these are on there. So out in the field, EMS use these a lot. So you guys may see a patient come in with one. And if the patient is revived and gonna stay on life support, then this has to come out and they're gonna put a regular ET tube in. So like I said, this would just follow, it's too big, the roof of the mouth. And then you bag from here or you bag from here. And then this one, you inflate, not quite as much, takes about 20 cc's. And then you see this is gonna inflate, block off the esophagus so air will go directly into the lungs. Most common problem with this one is if it's saying that you're not getting your volumes back, you need to reposition it because sometimes it just gets moved a little bit. So that's not uncommon to have to do. And again, go by your patient's size. And that just shows the LMA in place, blocking off the esophagus and allowing air to go right into the trachea.
How often will that, how often would the
get a little bit air into the stomach. That's just kind of a, yeah, that's just how it goes. There's not much you can do about that. So hold on, I want to see about